All right, hello, my name is Alexandra. I'm a student to become a family nurse practitioner. Nurse practitioners can prescribe medication, they can perform physical exams, they can do an array of things, and they can also treat acute and chronic illnesses and diseases. So let's go ahead and get started. Can you tell me your name, address, phone, age, and sex?
Okay, my name is Alyssa Dreiss. I live at 10 West Chestnut, Chicago, Illinois. My phone number is 224-715-2023. I'm white, I'm 28, and then I'm female.
Perfect. And then do you have a health care and an insurance provider?
I do. I don't remember the name, to be quite honest.
Okay. And then can you tell me your marital status as well as your occupation presently?
I'm currently single and I work in retail.
All right, perfect. All right, so what brings you in today? What's your chief complaint?
I've been having back pain.
Back pain? Where is this back pain at?
It's the lower back.
Okay, and is there things that alleviate it or make it worse?
Laying down makes it worse, I think.
Is there any time of the day that makes it worse?
Night, for sure.
Any aggravating or relieving factors?
Walking around sometimes helps, and as does ice.
Okay, and then you were saying it's your lower left or right side?
Left.
All right, is there any onset that it happens or is it kind of sporadic?
Sporadic.
All righty. So now we're just going to go into history of your present illness and past illnesses, okay? So can you tell me your last doctor's visit? Was it a routine visit or was it something you went to because you had pain?
My last doctor's visit was a routine visit. I would probably say like 5 years ago. I haven't been in a while.
And there's no significant findings on that visit?
No.
All right, perfect. Do you have any chronic illnesses such as cancer, diabetes, hypertension?
No.
All righty. Any concerns relating to your health, well-being, or disabilities?
I do have Raynaud's. I don't know if that's like considered a disability or not, but
okay.
That's about it.
And is that painful?
In the winter, yes.
Yes. So we're going to go back to onset. It's just in the winter.
Right.
Location, you'd say it's just your hands?
My hands, my fingers.
Okay. Duration, just the winter, or does it kind of progress?
It's just the winter. I'd say mostly when I'm outside.
Location outside. Okay. And then once again, just alleviating factors probably being inside or?
Being inside, not being cold, wearing gloves.
That makes sense. Alrighty. So then childhood illnesses. Did you ever have rubella, mumps, Ebola, pertussis, varicella, polio, tuberculosis, hepatitis, or HIV that you know of?
None of those. The only thing I can remember is pneumonia.
Pneumonia? At what age did you have pneumonia?
I believe I was 1 or 2.
Alrighty. So for immunizations, have you had your immunizations such as influenza, pneumococcal, hepatitis A, B, HPV?
I've had all of them, I believe.
Okay. Meningitis?
Yep.
Zoonotics?
Yes.
COVID?
Yep.
Do you know when you had these?
I think a lot of them I had like before I went into kindergarten. I think HPV I had when I was either in end of middle school or beginning of high school.
Okay, great. And then did you get your COVID vaccine?
I did.
All right, perfect. And then did you happen to know if you got your TD or Tdap vaccine?
I believe I have both. Probably high school, I would say.
Okay. And then have you ever had a TB skin test?
I don't think so.
Okay. And then do you have any allergies or drug reactions?
I'm allergic to shellfish.
Shellfish? Okay, what happens when you have shellfish?
I just get a rash on my face.
Okay, so no anaphylactic shortness of breath or anything like that?
No.
Okay. Do you know when that first started?
It first started after college, I would say around 22, 23.
All right. Have you had any hospitalizations, surgeries, any invasive procedures?
I had earplugs when I was little, and then I had a dental surgery in middle school.
Okay, so the earplugs, you would say we were in like...
I think I was 3 maybe or something like that.
Okay, so there I am. All right, and no issues after that?
No.
Alrighty. Any accidents, injuries, or harmful ingestions? This would be, accidents, injuries, and harmful ingestions would be like lead poisoning or car crashes.
I've been in a couple minor car accidents, but there was no injuries of any sort.
What years would you say those are? Or is that sporadic?
There was one in college that was on the highway, and then there was one after college on the highway, and then a couple minor like fender benders after college.
But no issues with any back problems or anything with that afterwards?
Not that I'm aware of at the time.
All right. You didn't go to the hospital or anything like that for this?
No.
Okay. All right. Medications. So do you take any medications daily or?
I take Adderall daily. It's 20 milligrams of dexamphetamine.
Okay. And how long have you been taking that for?
I started ADHD medication when I was 18 years old, about to go into college.
Okay. And then I also ask all my patients, do you take any supplements?
I take Ritual vitamins. It's like a multivitamin for women.
Okay. And you take that every day?
Yes.
What do you take that for? Just
I take it in the morning, two in the morning. I have low iron. I've always had low iron, so I take it for that reason mostly.
okay. And then there's no home remedies that you take?
No.
Alrighty. So I'm just gonna ask you about your family history, okay? So this is gonna be you, any siblings you have, your parents, any siblings they have, and grandparents, any siblings they have, okay?
Okay.
So I'm just gonna kind of, do you know of anything right now at the top of your head that any of your family has?
My dad's side has colon cancer.
Okay. Is that your grandfather,
Both my dad's mother and father both passed away from colon cancer.
Okay. And then anything else from your father's side?
Not that I'm aware of.
What about
acne? I guess.
acne? Okay. And then what about your mother's side?
Nothing I know of.
And do you have any siblings?
I have one sister.
Okay. Does she have any health issues that you know of?
She's allergic to peanut butter. I know, but that's not really a health issue. She has eczema.
Okay. And do you have any children?
No.
All right. So I'm just going to go off some illnesses. I'm just going to read them off. And if any of them kind of remind you that maybe one of your parents or familiar people have them, just let me know.
Okay.
So any other allergies besides the peanut butter?
No.
Okay. And you're shellfish. Arthritis, asthma.
My mom has arthritis.
Your mom has arthritis. Okay. Blood disorders.
No.
We talked about cancer. Any congenital or genetic diseases that you know of?
No.
What about cystic fibrosis?
No.
Okay. Diabetes,
No.
drug or alcohol abuse,
No.
emotional problems, gastrointestinal disease,
No.
any gout or heart disease,
No.
high blood pressure.
My dad has high blood pressure.
Alrighty. And kidney disease?
No.
What about any learning disabilities?
My dad is dyslexic.
Oh, okay. And then any neurological disorders or mental retardation?
No.
Any obesity or peripheral vascular disease?
No.
Sickle cell disease or trait?
No.
Seizures or strokes?
No.
Sudden death?
No.
Sudden infant death?
No.
And lastly, any thyroid disease?
No.
All right, perfect. So just talking more about your family, are you satisfied with your living arrangements and the relationship with your family?
Yes.
Even the family you don't live with?
Yes.
Great. Occupational history. So work-wise, can you tell me about the job you have now? Is there any health or occupational risk with that job?
I would say there's no health risks at all. I work retail. I've worked for the past 7 years.
All right. So there's no exposure to violence or chemical toxins, anything like that?
No.
All right. So do you have any concerns about you or your family's financial resources, including financial coverage?
No, not at all.
Okay, great. Even with inpatient care, so if you were hospitalized?
No.
All right. Can you tell me about your educational status?
I completed high school and then I went to I got a bachelor's degree from the University of Kansas.
Okay. What year was that? Do you remember?
I graduated in 2016 from college.
Okay, great. And with the bachelor's in?
It was journalism.
Great, okay. So now I'm going to kind of talk about your habits, okay? So I just want you to kind of tell me of your alcohol use and your frequency, would you say?
I don't drink during the week. I do drink occasionally on the weekends, like Friday and Saturday.
What do you drink?
I would say wine mostly.
Okay, and then do you know how many wine beverages or ounces you would have?
Probably 3 to 4.
3 to 4, and it's just a glass of wine?
Yes.
All right. Any tobacco use?
No.
What about secondhand smoke?
My dad used to smoke, but I do not smoke.
Does he still currently smoke?
No.
Okay. So no vaping or chewing tobacco?
No.
What about any caffeine-containing beverages?
I drink caffeine every day.
Okay. Do you know how much caffeine you probably drink a day?
I think it's 200 milligrams.
Okay. And you do that in the morning? Or?
In the morning, for sure.
And then any recreational drug use?
No.
All right. What about safety? Do you wear your seatbelt?
I wear my seatbelt every day.
If you bike, do you wear a helmet?
Yes.
Okay. What about firearms? Do you have any firearms?
No.
Okay. What about fire alarms or carbon oxide detectors in your house?
Our apartment has fire alarms. I don't know about carbon monoxide detectors.
What about radon?
I have no idea about that either, to be honest.
Okay. So now, moving on, what about your sleep patterns? How do you think you sleep at night?
Pretty well for the most part. I usually go to sleep around 10:30 and wake up at like 6 or 7.
Okay. Do you have any sleep disturbances at night?
Maybe like once a month I'll get a nightmare, but other than that, no.
Alrighty. So then activities and exercise, frequency, and what do you do for exercise, or do you exercise?
I would say I usually try and get 10,000 steps a day. Some days I don't get it, but I would say probably 4 days out of the week I get 10,000 steps.
Okay. So now I want you to walk me through your typical day. So I want you to walk me through where you wake up to when you go to bed at night. I just kind of want to get a gist of your typical day.
Okay, so I usually wake up around between 6 and 7. I'll get up, shower. I'll usually eat a granola bar, have some water, get ready, go to work. I'm there from like 10 to 5. And then I'll come home, usually go on a walk, have dinner, relax, and then go to bed.
All right, great. And then for your daily intake, I know that you said you took Adderall or Vyvanse. So I know that can kind of mess with your eating habits. Do you find that's been a problematic for you? Or?
No.
So can you kind of go through your daily intake for me, just so I know the last 24 hours. So what you had in the last 24 hours, if you can try and remember.
So I had, this morning I woke up, had a granola bar. I had a Caesar wrap for lunch, and then I had avocado toast for dinner.
All right. What about any the caffeine drinks or the water?
I have had 4 water bottles today, and I've had an energy drink, which was like 200 milligrams.
Would you say this is typical for you?
Yes.
Alrighty. So how would you say you deal with stress and your methods of coping in your life?
Pretty well, for the most part.
Okay. Have you ever sought outside help with problems, like mental health professional or clergy?
I've talked to a therapist after a friend passed away, and that's about it.
So would you say you suffered emotional, physical, or sexual abuse?
No.
Okay. So when your friend died, when was that?
It was in 2014.
And how many sessions did you go to?
I would say I went for about a month, once a week, maybe 2 months.
Did you find it helpful?
Yes.
Do you still deal with that, or do you have better coping mechanisms now? To where
I
you
handle it on my own, so I have better coping mechanisms.
Great. So, in your perception, do you think you've accomplished what you'd hoped for in this stage of life, and have you reached the milestones you wanted to reach?
Yes, for the most part.
Would you say that you obtain healthcare regularly, like you get annually checkups, or would you say it's more of an urgent thing when you do go and try and get healthcare help?
I should probably go to the doctor more. I haven't been in a few years, but I do go to the dentist twice a year, and I don't really have any major health concerns at this moment, so I would say I've always been a fairly healthy person.
Alrighty, can you tell me your place of birth?
I was born October 12th, 1993 in Arlington Heights, Illinois, at a hospital.
All right. And then do you have any current or past exposure to health hazards, being crime, violence, pollution, or lead or radon?
No.
This would be work, community, environment, or home?
No.
All righty. How is your perception of the adequacy of healthcare that you've been given in the past? Would you say that it's been...
I've always had pretty decent healthcare, I would say.
So it's been a pretty positive experience for you?
Yes.
Have you been compliant with the healthcare regime that's been set out for you?
Yes.
Alrighty. Do you feel that your perception of any ethnic or religious customs have affected or been a conflict with the response to illness or therapy prescribed?
Not at all.
No religious affiliations? Okay.
No.
So now we're just going to do a review of body systems. So I'm just going to kind of ask you head to toe about your body, and I just kind of want you to give me whatever answer you feel, okay? That you feel is most accurate.
Okay.
So any fevers, chills, malaise, fatigue, night sweats?
Today or in the past, like?
This would be just today or recently.
Okay,
like
no.
Okay, and then can you tell me your weight, please?
I weigh about 135.
And is that your average weight?
Usually, yes.
Are you preferred with that weight, or are you wanting to change it?
Would love to lose 5 to 10 pounds,
Don't we all?
but I'm good with it.
All right, so I see your nails are done. I love the red. So have you had any changes in your skin?
No.
Moles or nails? You would say that's all okay?
It's all been the same.
What about your sunscreen use?
I wear sunscreen on my face and neck and hands every day.
Do you know the SPF of the sunscreen?
It's SPF 46.
So you wear that every day?
Yes.
When did you start wearing that sunscreen every day? Or have you always done that?
I would say about 23.
All right. So any hair or scalp changes that you've noticed currently?
My hair, I would say it's been steady the past few years, but my hair used to be thicker in high school, I would say. But other than that, no.
Do you take anything for that to have thicker hair?
Occasionally I'll do like a hair growth supplement every now and then, but I don't currently take anything.
Okay. So do you know when your last eye exam was?
Oof, I'd probably say like beginning of college, so maybe like 9 years ago almost.
Have you noticed any changes with your eyes?
I used to have 20/20 vision. I definitely can't see as far, but I do have prescription glasses for like when I can't see far away, but it's not awful to the point where I need contacts or anything yet.
Okay. Have you had any visual disturbances in the past or current pain, halos, or problems with your eyes?
No.
No coordination problems or history of glaucoma, cataracts, or eye infections?
My mom has cataracts.
Your mom has cataracts. Okay. So what about your ears? You said you had tubes when you were younger.
Yes, ear infections.
Ear infections, yeah, okay. So that was a history of the pain probably when you were younger, you had the tubes. Any discharge, tinnitus, which is that ringing of the ears?
No.
Ear infections when you're younger, none currently?
None, yeah.
No hearing loss or use of hearing aids?
No.
Okay. What about sinus pain? So any nose pain, infection, any frequent upper respiratory infections or nosebleeds?
No.
No runny nose or unusual discharge?
No.
All right. So now we're going to talk about just your dental. Do you know when the last time you went to the dentist was?
It was actually this morning.
This morning? Okay. So any missing teeth, prosthetic devices, dental bridges, or dentures?
No, everything was good.
All right. And then no current dental problems, no bleeding gums, lesions,
Nothing.
sore throat, difficulty swallowing?
No.
No voice change or hoarseness?
No.
All right. What about your brushing and flossing habits?
I brush at least twice a day and I floss once a day.
Okay. And no problems with bleeding gums when you do that?
No.
All right. So for your neck, do you have any swelling or are there any lymph nodes of the neck that you feel are tender?
No.
All right. Any limited range of motion or stiffness in your neck?
No.
All right. So have you noted any swelling of your glands under your arms, lumps or sorenesses of your breast, or any nipple discharge?
No.
Do you perform breast self-exams regularly?
Not regularly, but I haven't really noticed any at all because I put lotion on every day everywhere, so I haven't noticed anything.
So you would say with the lotion, you feel like that's adequately enough that you don't need
Yes.
to? Okay, perfect. And then, have you had a mammogram before?
I have not.
Okay. And any, you said no, told us no history of breastfeeding.
No.
Alrighty. So recently, have you had any cough, sputum production?
No.
Okay. We talked about no shortness of breath, no wheezing, no history of asthma.
My sister has asthma.
Sister has asthma, and then pneumonia you had as a child, but
Yes.
nothing currently.
Correct.
Any bronchitis or emphysema?
I had bronchitis once as a child as well.
Okay. And then any exposure to tuberculosis?
No.
Okay. What about any heart problems? I know we talked about your family. Do you have any heart problems?
I have a heart murmur, but that's it.
Murmur? Do you know anything else about it, or has it been an issue ever?
It's never been an issue, it's minor. And then my grandpa had a heart attack about 10, 15 years ago.
Do you know when you were diagnosed with that heart murmur?
Post-college, I would say 24.
Okay. Hypertension, high blood pressure. We talked about your dad having
My
that.
dad, yeah.
Any chest pain?
No.
Any exercise intolerance? I know you said you walked a lot, so no problems with...
No problems with that.
Great. Palpitations?
No.
Edema?
No.
Claudication?
No.
Rheumatoid heart disease?
No.
And anything about cholesterol levels that are high, lipid or triglycerid levels that are high?
No.
All right. So can you describe to me your bowel patterns and frequency? So that just being your stool characteristics on the normal, like their color, consistency. Are you straining?
I would say once a day, brown, normal.
Okay. No rectal bleeding or abdominal pain?
No.
Do you have any food intolerances besides the allergy to shellfish?
No.
Okay. No nausea, vomiting, or diarrhea?
No.
No issues with constipation or swelling of the glands in the groin?
No.
And then any history of peptic ulcer disease or gallbladder disease?
No.
Okay. All right. So any dysuria, hematuria, frequency or incontinence. This would be stress incontinence, urge, to where you're unable to make it to the restroom to go to the bathroom.
No.
Alrighty. Nocturia, which would be, do you wake up at night to go to the bathroom?
No.
Okay. And then any UTI infections or STI, which would be
Nope.
no discharge?
Nope.
All right. Do you remember the age when you got your menarche, which would be your period?
I was 13 or 14.
All right. And then when was your last menses? It's your last period.
It should have been Labor Day weekend, but I got a UTI about a year ago.
Okay. A UTI or UD?
What's it called when you get it?
IUD?
Yes, IUD,
Okay.
thank you.
A year ago?
Yes.
All right. So before you got the IUD, How would you say your cycle was? Low or heavy?
I would say my cycle was regular. It was, I don't usually have super heavy periods, but it was.
And how many days would you say?
4.
All right. And you said you've never been pregnant before, correct?
Correct.
All right. Do you have any fertility desires?
Possibly kids in the future.
All right. Any pap smear history?
I've had a pap smear. It was 2 to 3 years ago.
All right. And were there any results from that?
Everything was normal.
All right. And then postmenopausal, we're not there yet. So now we're going to talk about sexual history.
Okay.
Do you have a sexual history with men, women, or both?
Men.
Okay. Do you have a current partner or a lifetime partner?
I have a current boyfriend.
All right. Do you use any other contraceptive besides the IUD?
No.
Okay. Is the current sexual activity a joke for you and your partner?
Yes.
Okay. Based on your practices and risk for communicable diseases, I don't think we need to require any anal or oral exams. Do you perform anal or oral?
Anal, no. Oral, sometimes.
And vaginal?
Yes.
Okay. So any pain, stiffness, or in your muscle, joints, or back that create any limitation for range of motion?
No. Last week I had back pain, like I said, my lower back.
Yes.
But now it's much better than it was.
Okay. So did that impair your gait at all? Your walking, was it hard to walk?
Yes, it was hard to walk.
So you said you came back, but it's still there. It's still bothersome. It's just not as bad as it was.
Correct. It's more so uncomfortable now.
All right. Is it swelling at all?
No swelling.
Any weakness?
No.
Okay. Any history of head injury?
No.
Loss of consciousness?
No.
What about any problems with coordination or numbness?
I get numbness in my fingers in the winter from Raynaud's.
Okay. Any tingling, seizures, or tremors?
No.
What about headaches as a described pattern?
I get headaches every so often. I sometimes also get migraines every so often. I haven't had one in months though.
What's the onset of those?
I don't know if it's like a lack of water or stress, but probably one of.
And where's the location at?
In front of my eyes, usually like the left or right side of my eye.
Okay, and the duration, does it last minutes, hours?
The most I would say is an hour. Usually it's around 30.
And what would you say the characteristics are? Is it squeezing, sharp, burning?
It's like a pounding, I would say.
And it's constant?
Yes.
Okay, like I mentioned earlier, what are the alleviating factors?
Sometimes I'll throw up and it'll immediately be better, or I'll take an Advil and ice my forehead and I'll get better from that too.
Okay, and what are the aggravating factors? Is it light? Is it movement?
Light and movement, I would say.
Okay, and then the time is just sporadic.
Yeah, usually I probably get maybe 3 a year now.
And the severity, does it just range from 1 to 10 on a scale of 10 being the worst pain, 1 being?
I would say somewhere between like 6 and 7.
Okay. And then any history of anemia? You talked about earlier you take the Women's Health because you had...
I have low iron. I'm anemic.
Okay, you are anemic, and that's kind of your baseline?
Yes.
Alrighty. Any problems with that, or is that just kind of where you live at?
No, I bruise easily, but other than that, I'm okay.
Okay. Any sickle cell traits?
No.
Okay. Any bleeding tendencies? You said you bruise easily, but you don't have any problems with bleeding out?
No.
Okay. History of blood transfusions?
No.
Thyroid problems?
No.
So hot or cold intolerance would be like the Raynaud's. So that's just in your hands, correct?
Correct.
And it's mostly in the winter?
Correct.
Okay. And then do you have any polyuria, which would be like an increase in urine?
No.
Polydipsia or polyphagia?
No.
All right. Well, it was a pleasure chatting with you.
Thank you so much.